Assalamualaikum and hi, my name is Nur Alia Amira binti Muhammad Najib. I will present about food allergen, which is fish. First of all, I will start with introduction. As we know, the body immune system keep a body healthy by fighting off infection and other dangers to a good health. So what is meant by food allergy is, it is an adverse immune response that occur reproducibly on exposure to a given food, meaning immune system overreact to a substance in a food and identify it as a danger. Then it trigger a protective response. So food allergens are typically naturally occurring protein in food or derivative of them that cause abnormal immune response. The protein that trigger the reaction are called allergen. Okay, there are 8 major food allergens include eggs, nuts, milk, peanuts, fish, wheat, soybeans, and also shellfish. So the common mechanism leading to a various food allergy is because lack of immunologic and clinical tolerance to an ingested food, which result in immediate or acute reaction. These reactions are mediated by specific antibody, which is immunoglobulin E or IgE, and delayed clinical disorder through specific immune cells. Symptoms of a food allergy categories can be from mild to severe, and the most severe allergic reaction is anaphylaxis because it is a life-threatening whole body allergic reaction. Although shellfish allergy is the most common allergy, but allergy to fin fish is also a common food allergy. So we will go through what is meant by fish allergy. So fish allergy is one in which our immune system reacts abnormally to a wide variety of fish. Fish is an important source of food worldwide, as we know it provides abundance of protein. So common fish that cause the allergic condition include tuna, salmon, mackerel, and many more. So fish allergy is caused by a protein called palbalbumin. So this palbalbumin present in fish are relatively heating stable, meaning that they are not destroyed through cooking. So the condition affect adults more than children. Okay, this is a few signs and symptoms of allergic reaction. Maybe not included high swollen face and mouth, breathing difficulty, tingling in mouth, nausea, vomiting, indigestion. But in some individuals, fish allergy may lead to an anaphylactic shock, which is a medical emergency. And when the immune system recognizes certain protein in fish as being dangerous or harmful to the body, intake of fish result in the production of antibodies, specifically IgE, and the next time the individual is exposed to the protein, the antibodies that are circulating in the blood cause an antibody antigen reaction. This results in the production of histamine and other chemical messengers, which cause the symptoms seen during an allergic reaction. So some individuals are allergic to one type of fish, which is known as monoallergic, while others to many and some to all. An allergy may not only be triggered by eating fish, but it may happen by touching or consuming any food in which fish byproduct is used. Next, the diagnosis of fish allergy may involve the following: physical examination, assessment of symptoms, medical history evaluation, meaning a history of allergy in the family, and also skin or blood tests. For the treatment of fish allergy, the person need to avoid consumption of any food containing fish, and then anti-allergic medication for mild reaction, which is antihistamine. And another one, in the case of anaphylaxis, a severe allergic reaction, epinephrine or adrenaline is immediately administered. Okay, for way to prevent fish allergy, first we need to check ingredient of the food before using, and also educate oneself on food that potentially contain fish. And secondly, avoid contaminating food item during food preparation by using separate utensils. And the next one is avoid all hotel and restaurant that are serve seafood. And also try to explain your food allergy to the hotel restaurant service staff and ensure that your food is without the substance you are allergic to. Okay, so I will conclude that allergic reaction to fish can be sometimes be immediate, severe, and also life-threatening. Not always adults, but children also can have fish allergy, and only a limited numbers of protein can induce specific IgE mediated immune reaction, and the major fish allergen are the bulbul. So overall, the bulbul content differ in fish species, and different amount of bulbul correlate with the variable allergenicity of fish. While a fish allergy may be less common than a seafood or nut allergy, but it is also serious and always recommended to carry at least 2 epinephrine auto-injector at all times if a person has been diagnosed with a fish allergy. And then it is important to note that those who are allergic to fish may not be allergic to shellfish or vice versa. However, it is best to check with the healthcare expert on what type of seafood you are specifically allergic to. So next, I will proceed with the question. For the first question is, what are the risk factors for fish allergy? So the risk factor for fish allergy may include exposure to fish, meaning it may be happen by consuming, touching, smelling, inhaling, tasting, and also contact with fish. The second one is any family history of seafood allergy. And the third one is when the person have one form of allergy, it may be at risk for another form. And the next one is adults who are exposed to fish regularly may have higher risk to get the condition. Next question, who gets fish allergy based on age and racial distribution? Fish allergy can occur in children and adults, but 2 out of 5 individuals develop the condition during adulthood. For the all racial ethnic groups are equally vulnerable to the condition. However, coastal countries show more cases of fish allergy than others. So I think that's all from me. Thank you.